What I'd like to do now is just hand over to Audrey, who will share a little bit more about World Patient Safety Day and the role of the consumer voice in healthcare quality. Thank you so much, Audrey.
Thank you. So mark your calendars, because September 17th is World Patient Safety Day. This is one of the World Health Organization's global public health days. And this year, the theme is improving diagnosis for patient safety. So the importance of this day is that it actually brings together consumers, carers, families, communities, and healthcare staff and policy makers to actually show their commitment to patient safety. And one of the objectives this year is to empower patients and families to actively engage with their healthcare staff to improve the diagnostic process. And this is timely because today the conversation we're having is about how to include the consumer voice into driving safety and quality. And if I can go on to talk a little bit more about why that's important to us. So for us, consumer and carer and family feedback is a really valuable source of information. That's for both the department as well as for our health services. Your feedback comes to us through different mechanisms, and care opinion is one of the key mechanisms for this. And what we do with that feedback, it allows us to learn from your healthcare experiences and gives the opportunity to identify the ways in which we can do things differently, but it also gives us the opportunity to celebrate the things that are done well, because most of the things that are done very well. Within the health services, we do have what I think is a good safety culture. It embraces and it encourages consumer feedback, and we see this as a learning opportunity. Because learning, as Katrina and Casey will show, is basically fundamental to continuously improving. And I think just before I hand over, I would also like to say that in the complex environment that is health, it's important that we don't forget the individuals who are at the heart of healthcare, and that's both staff and consumers. And so in November of last year, we launched a statewide strategic and operational plan to improve safety and quality in healthcare. And those plans emphasize the importance of a person-centered approach. So consumers, families, carers, staff, and executive all contributed to this plan. We were actually touched by how much feedback we got, and it outlines our approach to better understanding what matters to consumers. In fact, there's an actual program called What Matters to You, and also giving staff the tools to support them in providing healthcare. So I'll hand back now. A couple of things have struck me. I think if I think about it from the patient or the consumer perspective, I really liked how Casey talked about the paradigm of what it feels like if you're a consumer coming into hospital and that power dynamic. And I was actually thinking, even as someone who works in health, we all experience that. And then I guess if you multiply that by whatever factor for a lay consumer, it's actually really hard to ask for things, particularly depending on what lens and what background you come from. So the aspect that I really resonated with was the bit about empowerment. And because that's really what we all want in our lives, isn't it? To feel like you've got control over what's happening to you, particularly at something that's quite as monumental as childbirth.
Yes, absolutely.
No, so I really enjoyed that bit. I think I kind of took, like Katrina did, that bit about when people give anonymous feedback, because the question that came to my mind was, what do we need to do to make it safer for people to give us feedback and not feel like they have to be anonymous?